Hey, it's your man AA Ron. It's been a little over 2 weeks. I didn't do a video last week because, well, I started to get some nerve pain show back up about 6 days after the surgery, and I didn't really want to talk about it because I wasn't sure what was going on. Met with the physician's assistant. He told me it's normal, there's inflammation in my neck, and I know I'm personally not very good at taking a break. I was out walking and doing things like cleaning my house, doing laundry, making beds, whatever, lifting more than 10 pounds, which is the limit. And so I'm sure it was just my own activity created additional inflammation on a nerve that's not healed yet. So I have noticed it's gotten better, and then some days I notice it again come back. But I think if you're having this surgery to have your disc replaced in your neck after it being compressed for 9 or 10 months like I did, that you're likely to have a couple bad days after the surgery, even though I don't have recurring nerve pain consistently like I did a couple weeks ago before the surgery. So things I'm able to do right now, the doctor didn't change any restrictions. I have tried to ride my bike around, for 5 to 20 minutes, and it's aggravated it a little bit, but it really hasn't made it any worse. The glue came off of my cut, which looks pretty much fully healed at this point. If you want to get a close-up, it's really not that bad. There's still a little glue here. I don't think it's really that noticeable. I don't have neck folds for them to hide the scar in like some people, but I'm not that concerned about something like this. Last year, what probably caused this was or at least instigated it, was a concussion, and I don't have any marks from that except for where my glasses imprinted in my face, and then on the bridge of my nose, same thing, the glasses. As far as strength coming back, it's going to be a long, slow process. I had muscle atrophy that started maybe 3 months after the injury last year. I noticed my muscles were shrinking. It got to the point where my ribs were visible. I have what I would consider fairly thick pectoral muscles. They just disappeared almost completely. And I think that the nerve has to grow back enough now for the muscle to be able to be controlled properly, and it'll eventually come back. So not too concerned about that, but I mean, only time will tell how much recovery I get. Overall though, I mean, I have great movement in my neck. Some of these movements, I can notice my nerve feel a little bit agitated, but most of the time I feel pretty good, and I'm able to be pain-free. Just like a portion of the movement, I notice it and then it calms down. But hopefully in a couple weeks, the nerve is no longer in this irritated state, and I don't have any of that, like a normal person who doesn't have a nerve injury. I would suggest, if you're having neuropathy that is based on a herniation and they haven't been able to fix it, or it hasn't been able to fix itself within a month or two, go back with your neurosurgeon or neurologist and talk to them about what your options are. For me, this was a really long process. The herniation may have recovered once or twice, but it went on for like 10 months, so it kind of needed to be done to keep myself from having any more permanent nerve damage. Thanks for listening, and I hope anybody who has a similar issue gets it resolved naturally and doesn't have to have surgery, but this is a good option if it comes down to it. All right, talk to you guys in a few weeks.